Thank you for joining us for our presentation on research and applications of 3D printing to promote and augment contextualized services. I'm Elizabeth Sharp and I'm an OT here at RHI.
And my name is Christian Lauletta. I'm also an occupational therapist here at RHI. So what is 3D printing? 3D printing is a manufacturing process that creates a physical object from a digital model file. The technology works by adding layer upon layer of plastic material to build up and complete an object. This is in contrast to a typical plastic manufacturing that uses molds that plastic is injected into. And we have here a video of how the 3D printer works. So the goals of our project and using the 3D printer in the therapy process was to provide contextualized treatment items in the rehab setting, which means real life activities that are identified by the patient and or family that will be done in home or community after discharge. Increase access to adaptive equipment during the patient's inpatient or outpatient therapy stay, and to allow patients to discharge with custom adaptive equipment. And this implementation of the 3D printer aligns directly with the American Occupational Therapy Association Choosing Wisely campaign, specifically item 1, which is directly aligned with providing intervention activities that are purposeful and meaningful to the patient.
The significance of our research includes 3 main categories, including cost, customizable, and contextualized. First, we're going to begin with cost. The researchers completed a cost-effective analysis comparing the cost and print time of 3D printed adaptive equipment to the price and shipping time of obtaining commercially available alternative items. The researchers found that the practitioners can create devices in a timely manner at a much cheaper cost. Researchers found it cheaper to print items in the clinic than purchasing adaptive equipment and orthosis outside. Also, they found that 3D printing increases accessibility to adaptive equipment for low-income families, low-resource clinics, and rural facilities that will be discharging home with the product. Therefore, it is more cost-effective for our clinic, and it saves time for practitioners and families. Next, we have customizable. Adaptive equipment can be purchased at stores. They're not designed to allow patients the independence for donning and doffing. Therefore, the 3D printer allows for a unique design to be fabricated that supports the client and their environment and conforms to the patient's body while promoting independence. Therefore, occupational therapy practitioners can use a 3D printer to design and manufacture an assistive technology device that is safe, generally preferable to its off-the-shelf equivalent. It can be used also as a highly customizable and cost-effective assistive technology that is unique to the client and replaces the over-the-counter universal devices that you might find on Amazon, Walmart. So a custom product will accommodate their specific physical, postural, or cognitive barriers that may limit a patient's independence with donning or doffing. Therefore, the main takeaway of this is that 3D printing allows for the highly customizable items, and it leads to an increase with the independence of donning and doffing. And lastly, it allows for contextualized treatment. RHI has a 3D printer on site, which allows for a variety of contextualized items readily available to our patients. Here we serve a large, diverse population. For example, if we have a contractor, we have adaptive tools in our toolbox found in the clinic. If you're a nail technician, we have a hand model for you to practice painting nails, just to make it specific to the tasks at your job. Universities in the United States are adding 3D printing into their occupation and physical therapy academic curriculums, such as the universities in Cincinnati, New York, Maryland, and Nevada. And as a recent grad of UIndy, we have also been implementing research at UIndy using a 3D printer.
So the methodology behind our project was using the 3D printer first and foremost. So the 3D printer was generously funded through the RHI Foundation. The 3D printer that we currently use at RHI is the Ultimaker 2 Extended Plus. So obviously there's the cost of the initial cost of the printer and the supplies that came with the printer. And then there's the cost of the filament, which is the plastic that is fed through the printer, as discussed earlier. And that is obviously a consumable, so something that has to be replenished over time. As far as the files that go into the printer to make the object that we're desiring, those are all either free online already designed by the 3D printer community, or designed by myself or others that are trained in the software using what's called a CAD software program, which is also free online. And then another benefit of this overall project is that it reduces shipping times and costs associated with the items that we're printing, that we don't have to worry about shipping times and costs because we're obviously printing them in clinic. The printer, the materials that we use, the plastics that we use that are fed through the filaments, we have 3 different varieties that we currently use. There's ABS, there is TPU, and there's PLA. They all have their kind of unique properties that make them slightly different. The ABS, which is typically associated with like the Lego plastic, is a lot more tougher material. It's a traditional plastic, as well as the PLA, which is another traditional type of plastic that's a little bit more flexible, but also a little bit easier to work with. And then the third material that we use, the TPU, is a little different in that it is, it's not rubber, but it rubber-like. So it's still plastic, but it's very flexible plastic material. The other part of our methodology included, once we had, the 3D printer up and running, the materials in place, and we implemented an initial 3D printer education in-service to the entire therapy department. So that was essentially what you're hearing today, with, explaining the printer, explaining how it works, and also how it can be utilized. So that was provided to everyone that was interested in the therapy department. And then, as well as individual training and competency checkoffs, were designed for select therapy staff members to actually learn how to use the printer. So how to turn it on, how to set it up, and actually make a print. Those select people were chosen based on their locations in the different departments. So we tried to spread those people out to have them on different therapy units, so that we had at least, the goal is to have at least one person for each unit, so they could be the point person. If anyone on that unit had an idea or something that they would like to print on the 3D printer, they could go to that person, and then they could try and implement it on actually printing it on the 3D printer.
And that leads into the pros and cons of using the 3D printer. So I'm going to start with the pros column. So variety, just as Christian touched on, the different variety between the patient populations on different units. You might be fabricating something on the spinal cord unit or the stroke. So we have the variability for that, but also the different occupations. Like we have musicians, artists, construction workers, gardeners, waitresses, all of those different patient populations as well. It is safe during the times of the COVID policies. We need something that is easily cleaned. And then we also have the ability to make sharp items that you would see, say like fishing hook or a sewing needle, but we make it with the plastic material. So it's going to be safe for our patients with those cognitive deficits, unit 3 and 4, but also say an outpatient, if someone doesn't have great fine motor coordination or dexterity, that's going to be a safer option as they continue to improve their coordination. The next thing is custom. So for example, we made a custom bilateral cup holder to meet a patient's active wrist flexion. And that's also going to go for postural disorders. so that we can put their hands or extremities in a position that is going to help allow for their independence with the task. Cleaning, we can reuse items. So we have a loaf of bread that we printed and that we can practice continually recutting. It has Velcro in the middle for some tension during the cut, but also you can practice spreading the jelly back on it instead of that waste cost of, say, a real piece of bread. You can reuse it over and over again. And then that also goes in with the cleaning policies again, COVID, that we can use it with multiple patients after just a quick wipe with the sanitary cloth. The next pro is its on-site resources. So they're receiving these custom items prior to discharge. And then lastly, cost. So we ran a short cost analysis on the items that we've printed and compared them to Amazon pricing. So example, it was 10 cents with the 3D printer to do a finger orthosis compared to $25 on Amazon pricing, or a trachea model that Christian printed for our speech therapist. That's priced at $45 online on Amazon, but we printed that for less than $1 here. So the cons are time. Some of these prints do take a large amount of time, a couple hours, but as we started early in our day, we can monitor it, and it's usually done by the end of the day, and we'll make sure that that is printed before a patient discharges or before their next outpatient therapy. Training, we do have to take that time, he said, for the checkoffs. So that's roughly about an hour just to get kind of through the education, and then taking time throughout the day, some weeks just to do the prints, refine the documents, and kind of get the print custom to what the patient needs. And then, as you said, the initial cost as well. So to go further into examples of specific things that we have printed, in the adaptive category, we have a grocery handle that has 3 different hooks. So it's a gross grasp for a patient, and then it holds those bags to kind of take the pressure off if they don't have appropriate strength, or if they don't have the correct dexterity in all their fingers, they can just do that gross grasp. The nail holder, we've had construction workers, it helps pinch the nail as you're hammering, but it takes their fingers away from the point where you would put the hammer, and it moves it back so that it's a wider base that will support the nail upright, that is safer for the patient. Going into safety, I already talked about fishing hook, needle to take away the sharp object. And then simulated pet care, we have animal stool that we've made for the dogs or for cats. So we have a litter box here for cats, and then we'll have the patients get down, act like they're scooping out the stool, placing in a bag, walking to the trash can. So that helps with that contextualized treatment. But also a guitar pick. We have those now that can be individualized, and even some take them as souvenirs after they kind of go through therapy and figure out how they can be independent again with adaptive ways to play their guitar or to hold different picks to their fingers and posturing. Here are some more photos of the items that we've made. So we have an adaptive standing block there for a wider base. There's that loaf of bread I was talking about, our hand model there in the top left, that patients, if they don't want to paint their own, or they're used to painting another person's nails, they can act like the hand model. They're at work. We have phone stands. There's the fishing hooks. We also make these models that can be customized. So we have a Merry Christmas one, or down to an airplane model that can work on the fine motor. We also have a button hook there. And then this rubber material is in the dog bones, and that's going to give you kind of that squishy feel, but they can play like they're throwing toys around with the dog, pick them off the floor after their dog's made a mess. But these are some of the things that we've made here with the 3D printer that have made our patient stay more enjoyable. And leading into that, I have some examples and quotes to share with you from the patients here at RHI after using some of our 3D prints. So after the fishing hook, the patient said, "I loved having the opportunity to improve while participating in my favorite thing, of fishing." So that goes right into our occupation-based care and contextualized treatment. Pet care items. "I was nervous I couldn't do this, care for my dogs, after my stroke, but this showed me that I can." the hardware nail holder. I can't do this anymore, which he means hammering nails, because my coordination is messed up now. The OT introduced a 3D printed adaptive tool and the patient was able to hammer the nails again. Wow, I can't believe they make something like this. And the last thing was the custom handled cup holder. And they said it made me so much more independent and works much better than those big cup things. So as you can see that we've had great outcomes with this so far, and we're excited for the future plans to conduct formal research. But informal qualitative data was obtained from the patients, which directly impacted kind of their functional use of these 3D items. And we're excited to see how these patients have implemented into their lives and how the therapists have been open to implementing it into their therapy sessions. And we're excited to come up with some new prints.
So where do we go from here? So some ideas that we've had from our initial experience we've been using the printer now here at RHI, I think for about 2 to 2.5 years. I've learned a lot about how it works, as well as the limitations that we currently have with our current equipment. One idea that would be super beneficial to kind of going back to what Elizabeth was talking about with customized orthosis would be at some point in the future obtaining a 3D scanner. So that would allow us to actually scan the patient's hand, and that way we could design on the CAD software around that 3D scan an orthosis that would fit the patient perfectly. So right now we can definitely make orthosis, and we have, but it's limited by the fact that it's just based on what our clinical judgment is and the patient size and fit for the patient. So 3D scanner is something that we would hopefully we could look into obtaining in the future to further along the use of the 3D printer. And then just generally just continuing to grow the 3D printer, like the functional item catalog that we have. So obviously Elizabeth showed you, we have a lot of very unique, wide range of items that can be used in a lot of different ways, but there's, essentially the 3D printer is limitless. The only thing that's really limiting what we can make is the size of the print bed. But that, so far anything that someone has come up to me and asked about making, I've been able to find a way to make. It's just a matter of like, me and Elizabeth and our team is, we only have ideas from our own brain. So it's, hard to come up sometimes with ideas. So we have talked about implementing an idea box or a way for the staff to, submit ideas, requests for things that they would like to be, seen made. And we've done that, just by word of mouth. But I think if we could find a way to formally do that, that would be really helpful. We've also talked about mass producing high use items. So some of the items such as like a phone stand that we use quite often and give to patients for discharge. It would be nice to be able to just like make a big production of that and have that, so that we don't have to be making them right on the day that, the patient needs it, and so forth. So idea would be to just mass produce and like have like a box of items that are used often. They do make food safe filaments. So an idea we've thrown around is having, purchasing that filament and, making some items that could like theoretically be used when like a utensil, for instance, that could be used in eating food. And then getting others involved. So it kind of goes back to the idea box, but also just right now, the way we use the printer is very therapy related. And that doesn't necessarily have to be the case. I think that it's something that people find very fascinating and want to get involved in. I think they just, it's, the exposure to it isn't super high in our hospital. And I think it would be really great if we could find a way and to get other departments involved, get, as many people interested in using the 3D printer as possible. One example is, I had 3D printed some of those face mask straps to help hold the face masks on the back of your neck at the beginning of the pandemic. And those were dispersed throughout the hospital. I had a lot of people that were interested in kind of questioning like how they were made. And I think just taking that and taking the next step and getting as many people involved as possible would be awesome. And then contributing to the advancing evidence-based practice, it would be really amazing thing that we could do. Like what we're presenting here is a pretty informal research. We did some qualitative analysis of patient satisfaction, but finding a way to like actually turn this into a formalized research project, because there is a continuing growing amount of research out there and the applications of 3D printing in the healthcare setting, as well as specifically in the therapy setting. But we just haven't gotten there yet. So I think that would be an awesome next step to actually formalize, either qualitative research study or quantitative research study. As far as qualitative, we could look at patient satisfaction or, patient outcomes as far as, what they enjoyed or what was beneficial. And then quantitative research, like actually looking at cost analysis, like how much money we're saving either the clinic or the patient, as well as, seeing if we could find a way to tie that into patient outcomes would be a really amazing thing that we could try to do. And then, as we said before, like just continually growing the catalog of contextualized treatment items. So that is all we have for you today. You can see here our references that we drew from for this project. Thank you so much for tuning in and listening to this presentation. If you have any questions or if you have any ideas for things that you'd like to see 3D printed, until we can formalize, a formal way to provide that information, you can always email me, Christian Lauletta, at rhin.com, or Elizabeth Sharp at rhin.com. And we'd be happy to answer your questions or, investigate and look into making the things that you'd like to see. So once again, thank you so much.